The emergency operating room blazed under bright surgical lights, heavy with the smell of antiseptic. A multi-trauma patient lay dying, blood flowing everywhere. Panicked doctors shouted, "Wait for the head surgeon to arrive." But a young nurse with long brown hair stepped forward. For 3 straight hours, she controlled the scalpel, the clamps, directing every movement without rest. When the door burst open and the head surgeon walked in, he froze completely. Before his eyes, a nurse was commanding the entire surgical operation. Her name was Clara Jameson, 29 years old with fair skin and long brown hair that she kept professionally tied back during her shifts. She had a slender build that made her appear almost fragile in the high-stress environment of the surgical unit, but her dark eyes held a depth of focus and determination that few people took the time to notice. Clara worked as a surgical nurse at Metropolitan General Hospital, a position she had held for 3 years since completing her nursing degree and specialized surgical training. She approached her work with quiet dedication, arriving early for every shift and staying late to ensure that surgical suites were properly prepared for the next day's procedures. To most of the doctors and medical staff who worked alongside her, Clara was simply another competent nurse who followed instructions well and rarely caused problems. She was the person who handed surgeons their instruments, monitored patient vital signs during operations, and ensured that surgical protocols were followed precisely. The younger doctors, especially the residents who rotated through the surgical department, often treated Clara with the casual dismissiveness that medical hierarchies seemed to encourage. They saw her as support staff, whose job was to facilitate their work, rather than contribute meaningfully to patient care decisions. "Remember, you're here to assist, not to think," Dr. Patterson had told her during a particularly stressful surgery just last month. "Doctors make the medical decisions. Nurses follow orders. That's how hospitals work efficiently." Dr. Mitchell, a surgical resident fresh out of medical school, was even more direct in his assessment of Clara's capabilities. "It takes 10 years of medical education to earn the right to hold a scalpel," he had announced during a staff meeting. "Nurses can't possibly understand the complexities of surgical decision-making." Clara never argued with these assessments or tried to defend her knowledge and capabilities. She simply continued doing her job with quiet competence, ensuring that every surgery she participated in proceeded smoothly, and that every patient received the best possible care. But what her colleagues didn't see were the countless ways Clara went beyond her official duties to care for patients and support the hospital's mission. During night shifts, when staffing was minimal and oversight was reduced, Clara would sit with patients who were struggling with post-operative recovery. She would hold their hands during moments of pain or fear, providing the human connection that medical procedures alone couldn't offer. She regularly brought homemade meals for the hospital's orderlies and cleaning staff, understanding that their work was essential to patient care, but often went unrecognized and undercompensated. These small gestures of appreciation helped maintain morale during the long, difficult shifts that characterized hospital work. When equipment needed maintenance or surgical instruments required cleaning and sterilization, Clara would stay after her official shift ended to ensure that everything was properly prepared. She never complained about the extra hours or asked for overtime compensation, viewing these tasks as part of her commitment to patient safety. In her coat pocket, Clara always carried a small silver surgical clamp that had belonged to her mother. Engraved on the handle was her mother's name, along with the dates of her service as a surgical nurse. Her mother had worked double shifts for years, sacrificing her health and personal life to serve patients who never knew her name or appreciated her dedication. The clamp was more than just a memento. It was a reminder of the legacy of service that Clara had inherited and the promise she had made to continue her mother's work of healing and care, regardless of recognition or appreciation from others. "I saw her sitting all night beside a young patient after surgery, holding his hand until morning. Nobody knew, but I knew she was different from everyone else." Hospital orderly's testimony, The crisis began at 2:30 on a Tuesday afternoon when ambulances rushed a 26-year-old construction worker to Metropolitan General's Trauma Center. The patient had fallen 3 stories from scaffolding, sustaining multiple life-threatening injuries, including massive internal bleeding, possible spinal damage, and severe trauma to vital organs. The emergency department's initial assessment revealed the severity of the situation. This was the type of complex trauma case that required immediate surgical intervention by the most experienced surgeons available. Every minute of delay increased the probability that the patient would not survive his injuries. Dr. Harrison, the head of surgery, was the obvious choice to lead the operation. His expertise in trauma surgery and years of experience with complex cases made him the best qualified surgeon to handle such a challenging procedure. Unfortunately, Dr. Harrison was stuck in traffic on the other side of the city, delayed by a multi-car accident that had closed major highways. The surgical team assembled in the operating room consisted of 2 surgical residents, both of whom had significant training but limited experience with trauma cases of this magnitude. Dr. Patterson and Dr. Mitchell, the same doctors who regularly dismiss Clara's capabilities, found themselves facing a medical emergency that exceeded their confidence levels. "We need to wait for Dr. Harrison," Patterson said nervously, watching the patient's vital signs deteriorate on the monitors. "This case is too complex for residents to handle without senior oversight." Dr. Mitchell nodded in agreement, his anxiety visible as he studied the patient's injuries. "If we make a mistake with trauma this severe, we could kill him. Better to wait for someone qualified to take the lead." Clara stood quietly beside the operating table, monitoring the patient's condition while the doctors debated their options. She could see that waiting was not a viable choice. The patient's blood pressure was dropping rapidly, and his cardiac rhythm was becoming increasingly unstable. "Doctors," she said respectfully, "if we wait much longer, there may not be a patient to save. His condition is deteriorating quickly." Dr. Patterson turned toward her with obvious irritation. "Clara, you're here to assist, not to make medical judgments. We understand the urgency, but we also understand our limitations." "This isn't a decision for nursing staff," Dr. Mitchell added dismissively. "Surgery requires years of training that you simply don't have. We can't risk a patient's life based on a nurse's opinion." But as Clara continued monitoring the patient's vital signs, she began calculating surgical approaches and intervention strategies with a precision that surprised the observing medical staff. Her assessments were detailed, accurate, and demonstrated knowledge that went far beyond standard nursing training. "The internal bleeding appears to be coming from a severed splenic artery," she said quietly, more to herself than to the doctors. "If we can achieve proximal control and repair the vessel, we can stabilize his blood pressure long enough to address the other injuries." Dr. Patterson looked up sharply from the patient's chart. "How would you know anything about vascular surgery techniques?" The question hung in the air as Clara continued her assessment, identifying injury patterns and calculating treatment priorities with expertise that seemed inconsistent with her role as a surgical nurse. "I received advanced medical training during my military service," Clara replied simply. "I served as a combat medic with special operations units in Iraq." The revelation that Clara had military medical experience changed the atmosphere in the operating room, but not in the way she had hoped. Instead of recognizing her qualifications, the doctors seemed to view her background as irrelevant to civilian hospital procedures. "Military medicine is different from civilian surgery," Dr. Mitchell said dismissively. "Field medicine doesn't translate to complex surgical procedures in a proper operating room." But as the patient's condition continued to deteriorate, Clara made a decision that would change everything. She stepped closer to the operating table and picked up a scalpel from the surgical instrument tray. "If no one else is going to act," she said with quiet determination, "then I will." The reaction from the surgical team was immediate and intense. Dr. Patterson moved to block her access to the patient, while Dr. Mitchell reached for the emergency communication system to call for security. "You cannot perform surgery," Patterson said firmly. "You're not licensed for surgical procedures, and you could face criminal charges for practicing medicine without proper credentials." But Clara's response revealed something that none of them had expected. From her coat pocket, she pulled out a small leather wallet and showed them a military medical certification that authorized her to perform emergency surgical procedures under combat conditions. "I'm certified for emergency surgery," she said calmly, "and this patient is dying while we debate credentials." The operating room fell silent except for the increasingly urgent sounds of the patient's medical monitors. Clara stood beside the operating table, scalpel in hand, waiting for the doctors to make a choice between their institutional protocols and a human life that was slipping away. In that moment, I saw her hands shake slightly, but her grip was steady. It was like she had been preparing for this moment her entire life. Surgical assistance account. What happened next would be talked about in medical circles for years to come. Clara Jameson, the quiet surgical nurse who had been dismissed and underestimated by her colleagues, took control of one of the most complex trauma surgeries the hospital had ever seen. "I need someone to assist me," Clara said with an authority that none of the doctors had ever heard in her voice before. "Dr. Patterson, you'll manage anesthesia and monitor vital signs. Dr. Mitchell, I need you on suction and hemostasis." The transformation was immediate and startling. The woman who had been viewed as support staff was now directing the surgical procedure with confidence and expertise that left the residents struggling to keep up with her instructions. Clara's first incision was precise and confident, revealing internal anatomy with surgical accuracy that spoke of extensive training and experience. As she began the complex process of identifying and controlling the patient's internal bleeding, her technique demonstrated knowledge that went far beyond anything taught in nursing school. "Clamp," she said, extending her hand without looking away from the surgical field. "I need to isolate the splenic artery before we lose any more blood volume." Dr. Patterson, despite his earlier objections, found himself following Clara's instructions as she worked to save the patient's life. Her surgical approach was methodical and professional, addressing the most life-threatening injuries first while maintaining the patient's overall stability. "How did you learn to do this?" Dr. Mitchell asked in amazement as he watched Clara perform vascular repairs that he had only read about in medical textbooks. "Ramadi, Iraq," Clara replied without pausing in her work. "I was embedded with SEAL Team 6 as their primary trauma medic. When you're operating in a field hospital under mortar fire, you learn to work fast and think clearly under pressure." The revelation that Clara had served with one of the military's most elite units changed everything the doctors thought they knew about her background and capabilities. SEAL team medics receive some of the most advanced medical training available, including surgical procedures that many civilian doctors never learned. "We called her the Ramadi Medic," she continued as she carefully repaired damaged blood vessels with surgical precision that amazed her colleagues. "I performed over 200 trauma surgeries during my 3 deployments, working on everything from gunshot wounds to explosive injuries." As the surgery progressed, it became clear that Clara's military experience had prepared her for exactly this type of complex trauma case. Her ability to work under pressure, prioritize multiple injuries, and maintain focus during life-threatening emergencies was the result of years of training and experience in the most demanding medical conditions imaginable. For 3 straight hours, Clara directed every aspect of the surgical procedure. She repaired internal bleeding, stabilized damaged organs, and addressed spinal injuries with a level of expertise that left the assisting doctors in awe of her capabilities. "Suture," she said as she completed the final repairs to the patient's abdominal cavity. "His vital signs are stabilizing. We're going to save him." The operating room had become a place of focused intensity, with every person present understanding that they were witnessing something extraordinary. A nurse was performing surgery at a level that exceeded what many experienced surgeons could achieve. Just as Clara was beginning the closing procedures, The operating room doors burst open and Dr. Harrison, the head of surgery, rushed in. He had finally arrived after being delayed by traffic, expecting to find a patient in critical condition and a surgical team struggling to keep him alive until proper medical intervention could begin. Instead, he found Clara Jameson standing at the head of the operating table, directing the final stages of a complex trauma surgery that appeared to have been executed flawlessly. "What's happening here?" Dr. Harrison asked, his voice filled with confusion and concern about finding a nurse apparently performing surgery. Dr. Patterson, who had been assisting Clara throughout the procedure, stepped forward to explain. "Sir, Clara saved this patient's life. She performed a 3-hour trauma surgery that none of us were qualified to attempt. If she hadn't acted, the patient would have died." Dr. Harrison looked around the operating room, taking in the scene before him. The patient's vital signs were stable. The surgical field was clean and properly managed. The procedure appeared to have been conducted with professional competence that met or exceeded hospital standards. "Clara," he said quietly, "what's your medical background?" For the first time since the surgery began, Clara showed emotion. Tears filled her eyes as she explained her military service and the trauma cases she had handled as a combat medic with Special Operations Forces. "After I lost my team in an ambush," she said softly, "I couldn't handle combat medicine anymore. I came here to work as a nurse because I wanted to help people heal instead of just trying to keep them alive long enough to fight again." Dr. Harrison studied the surgical work Clara had performed, recognizing the advanced techniques and expert execution that had saved the patient's life. "This is some of the finest trauma surgery I've ever seen," he said with obvious respect. "You didn't just save this patient. You performed a procedure that would challenge our most experienced surgeons." The doctors who had dismissed Clara just hours earlier now stood in humbled silence, understanding that they had been working alongside someone whose medical expertise far exceeded their own. "I owe you an apology that I can never adequately express," Dr. Patterson said, his voice filled with emotion. "We treated you like you were just a nurse when you were actually the most qualified trauma surgeon in this hospital." Clara looked around at her colleagues, seeing respect and admiration where there had been dismissal and condescension just hours before. "I never wanted recognition or status," she said gently. "I just wanted to help people heal." As the patient was transferred to recovery, word spread throughout the hospital about what had happened in Operating Room 3. The quiet nurse who had been overlooked and underestimated had just performed one of the most remarkable surgical saves in the hospital's history. If you've ever seen someone underestimated who then showed their true capabilities, type "I owe an apology" in the comments below. In the hours following the remarkable surgery, Metropolitan General Hospital buzzed with conversations about what had happened in Operating Room 3. But despite offers of promotion, recognition ceremonies, and media interviews, Clara Jameson made a choice that surprised everyone who had witnessed her extraordinary performance. She declined all offers of advancement or public recognition. The morning after saving the construction worker's life, Clara simply returned to her regular duties as a surgical nurse, arriving early for her shift and preparing operating rooms for the day's scheduled procedures. But everything had changed in how her colleagues viewed her and themselves. Dr. Patterson, who had dismissed her capabilities just the day before, approached Clara during a quiet moment between surgeries. "Clara," he said with obvious humility, "I need to ask you something. Would you be willing to teach us? Really teach us what you know about trauma surgery?" Clara smiled with the same gentle kindness she had always shown. "Dr. Patterson, we're all here to learn from each other. I'd be honored to share what I know." Throughout the hospital, staff members began sharing stories about Clara's quiet acts of service that they had previously overlooked. The night shift nurses talked about how she would stay late to help with difficult patients. The surgical technicians mentioned how she always ensured that equipment was properly maintained and ready for emergencies. The hospital's administrative staff, who had never paid much attention to one surgical nurse among many, began to understand that they had been employing someone whose expertise and dedication went far beyond what her job title suggested. "She never acted like she was better than anyone else," said Maria Santos, one of the hospital's orderlies. "Even when she was saving lives in the operating room, she still remembered to ask about my family and bring coffee for the night shift." Dr. Harrison, the head of surgery, made a decision that reflected his understanding of what Clara's actions meant for the entire medical community. He called a hospital-wide meeting to discuss what they could learn from the events in Operating Room 3. "Clara Jameson reminded us of something we had forgotten," he told the assembled medical staff. "Excellence and expertise don't always come with the titles and recognition we expect. Sometimes the most qualified person in the room is the one who's been quietly serving others without asking for credit." The hospital's bulletin board, previously filled with administrative notices and policy updates, now featured a simple handwritten note. 3 hours. One nurse saved a life. Thank you for showing us what dedication looks like. Late that evening, as Clara completed her final rounds and checked on the construction worker who was recovering successfully, she sat quietly in the break room and pulled out the silver surgical clamp that had belonged to her mother. The engraving of her mother's name caught the light from the overhead fluorescent bulbs, reminding Clara of the legacy of service that had guided her throughout her career in both military and civilian medicine. "Mom," she whispered to the quiet room, "I kept your promise. I never stopped caring for people who needed help, and I never forgot that healing is about service, not recognition." She placed the clamp carefully back in her coat pocket, next to her hospital ID badge that read Surgical Nurse. Tomorrow would bring new challenges, new opportunities to care for patients, and support her colleagues in their work of healing. The construction worker she had saved would go home to his family. The doctors who had underestimated her would approach their work with greater humility and respect for their colleagues, and Clara would continue doing what she had always done, serving others with quiet excellence and unwavering dedication. Type, "I will live with honor," if you believe that silent courage can change everything. This story isn't just about a nurse who performed emergency surgery when doctors were too afraid to act. It's about something much deeper that affects every workplace, every organization, and every community where important work gets done. We live in a world that often confuses titles with competence, that assumes someone's job description tells us everything we need to know about their capabilities and experience. Every day, in hospitals, offices, schools, and communities around the world, there are people like Clara Jameson, highly trained, deeply experienced individuals whose expertise is hidden beneath job titles that don't reflect their true qualifications. They might be veterans working in civilian roles that don't utilize their military training. Former executives who chose simpler jobs for personal reasons. Retired professionals who continue working in support roles because they love serving others. The tragedy isn't just that these people are underestimated. The tragedy is what organizations lose when they fail to recognize and utilize the full range of talents and experience available to them. How many problems could be solved more effectively if we ask the right questions of the right people? How many emergencies could be handled better if we recognized expertise wherever it exists? Think about your own workplace or community. Is there someone whose background you don't really know? The security guard who seems to understand the business better than some managers? The administrative assistant who always knows how to solve problems that stump everyone else? The maintenance worker who offers insights that suggest deeper knowledge than their job requires? Clara's story reminds us that true expertise often comes with humility. People who have proven themselves in the most demanding circumstances often feel no need to advertise their qualifications or demand recognition for their capabilities. They know their worth isn't dependent on titles or status symbols. The doctors who initially dismissed Clara weren't necessarily arrogant or malicious. They were products of a system that teaches us to make assumptions based on hierarchies and job descriptions. But their willingness to learn and change after witnessing her capabilities shows that growth is possible when we're open to recognizing our misconceptions. Healthcare in particular depends on teamwork and mutual respect among professionals with different roles and responsibilities. When we create artificial barriers between doctors, nurses, technicians, and support staff, we limit our ability to provide the best possible care for patients who depend on all of us working together effectively. Tomorrow, you'll encounter people whose stories you don't know and whose capabilities you might not recognize. Before you decide who's qualified to contribute what, remember the quiet nurse who saved a life during 3 hours, when everyone else was too paralyzed by protocol to act. Consider that the person you're overlooking might be exactly the person who has the experience and skills to handle your most challenging situations. Because sometimes, the most qualified person in the room is the one who's been quietly serving others, while everyone else was focused on their own advancement and recognition. If you believe in stories that reveal the hidden heroes around us, share this story, and don't forget to subscribe to NL Touching Stories. We tell the stories that shouldn't be forgotten. Real people creating real stories, not mass-produced AI content.